All right, well, we're going to go ahead and get started so we can just have enough time for discussion and make sure that we get to connect with one another as this moves forward. So welcome everyone to our social work industry update and networking session. My name is Sarah Basinger and I am an alumni career counselor here at the Office of Alumni Relations at Tulane University. Also, I am a graduate of the Tulane School of Social Work class of 11, so this session feels a little bit more near and dear to my heart. And I'm excited to introduce and turn over to Dr. Maria Maude. She is the current Director of Field Education as well as Professor of Practice for the Tulane School of Social Work. And she's going to be our expert speaker today. So I'm going to do some as she goes through content. Just for some housekeeping, this is being recorded. If you could go ahead and just mute yourself right now, and then we'll have some time for discussion after about the 15 to 20 minute mark. So Dr. Glad, I'm going to turn it over to you.
Thank you so much, and thank you for the opportunity. As Sarah shared, I am Maria Glad, and I am a proud alum of the Tulane School of Social Work, class of 2004. So thank you all for being here. You could be anywhere, but you've chosen to spend your time with us. And so today I just prepared some slides and want to be available to talk about what is social work, where are the social workers, what is being done in the field. And so today's presentation speaks to that. As many of you know, more than 60% of mental health services are provided by social workers, and this pandemic is to no surprise. Social workers are being deployed, and we are very much engaged in medical social work, case management. We are found in the military services as well as clinical social work and telemental health services. We are found on Capitol Hill. We are senators. We are lobbyists. Specifically with regard to the telemental health, the pandemic has actually caused us to have an increase in services. We have received inquiries as much as 4 times as the norm. And because social workers are in the agencies, in the community, in these nonprofits, we are the face of mental health, and we are integral to the team, the interdisciplinary teams who are providing services. We are all resilient people. We know that social workers work with clients and meet clients where they are. Clients are the experts of their own narratives and their own experiences, and we try to bring hope and instill hope in the clients with whom we work. Again, the telemental health services have more than doubled as a result of trauma related to the climate of our times, related to anxiety with regard to the pandemic, and also we're seeing lots of isolation. So telemental health has been very instrumental in reducing isolation for those who are homebound, for our veterans, for our disabled individuals, and for busy families. We have families where mothers and fathers and grandparents are home with children and grandchildren, and they're teaching, they're working, and they're maintaining households. So we are seeing needs for outlets for help with stress and help with managing plans of care to move forward. Next slide, please. So this is a quote that was in an article that I wrote for some doctors. There were doctors who were experiencing intense mental health concerns and stress. And doctors were reminded that we are all resilient beings and we all respond to stress differently. We have our own thermometers, and we have to determine what to do with regard to responding to our fight, flight, freeze responses, and the activation of that response in our bodies. We are designed to handle stress. Social workers help normalize this for clients and patients. And we also help clients and patients realize what is necessary in order to create some normalcy, some routine, and to remain these resilient beings that we are. Next slide. So as we move through this space and think about what social workers are doing, especially in these times, we're helping clients reduce stress. We're helping clients be mindful of supporting one another, helping clients be mindful of supporting colleagues, family members, etc. And we are available for professional help. So social workers are very much in demand because we are part of the professional teams that are providing the services, the case management, the telemental health during these times. Next slide. So this is just a little reminder that we have to connect. As you see, during these times of isolation, my 93-year-old grandmother and I can't be together, but I do try to call her and FaceTime with her as much as possible, and technology has increased capacity for connection and reduced isolation. So I wanted to share this picture. And just a funny story, during this call, she told me, mind you, this is my 93-year-old grandmother, she said, Marty, you better put your mask back on so you don't catch that virus. So for the balance of our conversation, we both had our masks on, and we were talking through FaceTime with the assistance of my mom, who helped us talk to have a whole conversation during this pandemic. So connection is key to reducing isolation, and social workers are integral to reducing isolation for our aged populations, for our children, and for our adults. Here you see my 93-year-old grandmother who doesn't have access to others because she's more prone to possibly catching the virus based on her age and her body's lowered resistance. And so therefore technology has been key, and technology through social work services has helped us maintain contact with our aged population and helped us re-envision how we create connection with various populations. Next slide, please. So these are some suggestions that social workers, best practices have come up with. We've talked as colleagues, we've talked as practitioners, and obviously these can be easily accessed by most people. Getting outdoors is something that we all possibly have access to, and that's one of the best practices during this time. Social workers also help clients come up with plans of care. During this time, we're helping clients come up with some feasible options to help them stay active and engaged. During the early part of our conversation, we talked about my artwork behind me. And just to share that artwork is part of the self-care that I maintain, and I help our students integrate their self-care into their work, whether it's photography, whether it's artwork, whether it's letter writing, blogging. And so we encourage all of you to consider these options for self-care, you knowing yourself best, whether it's meditation, mindfulness. And then if you don't know what might be helpful for you, I've actually shared our self-care tips tulane.edu website, and that's on the Tulane School of Social Work, where we have all kinds of options for children, for cooking, for art, for adults, and for families to consider ways to connect and stay engaged during this time. This is a tool that you as social workers can use, or this is a tool that you can use in other areas of practice and interdisciplinary work as well. I think there might be one more slide. And so I just want to really emphasize that during this time, as you are in your careers or in your families or in your homes, to make time for self-care. In our classes here at Tulane School of Social Work, we emphasize self-care, and we even emphasize 1 minute mindfulness. So there's always time for some self-care, whether it's 1 minute or an hour, no matter where you are in your space and no matter where you are in your career, there's always time for some self-care. And so I'm going to pause there and give you time to react to anything that I've shared. I'm available for questions and really look forward to engaging and having a conversation. Thank you.
Thank you. Actually, I want to kick it off with a question about, especially with your work with field practice and knowing the climate of social work, especially within New Orleans, and I imagine in multiple cities with the online program as well. Can you speak to just kind of a high level, what are you seeing out there in terms of social workers that are looking for positions, or what is it, how has everything responded to COVID?
Excellent question. So we've actually seen an increase in opportunities in social work. As I said, telemental health is an area where social workers are needed. We also have school social work. So telemental health, school social work. We have services for homeless. We have services for aged populations. Nursing homes are still at capacity. Rehabilitation is still providing services. And so social work is very much in demand right now. We find that our students who graduated in December had many options. So whereas maneuvering the environment for an interview has changed to maybe there's this virtual interview process and lots of scanning and DocuSign procedures, we find that our students have actually had opportunities for employment as a result of the great needs in the community, with unemployment, with mental health, with policy work that needs to be done. Our students are seeing opportunities, and our past graduates are seeing opportunities. As the field director, I have to sign off on where a placement might have been when someone's trying to maneuver from a hospital to substance use. Substance use is another area where we've seen an increase in need as a result of people using coping skills to manage the pandemic, as well as the climate with regard to racial trauma.
Thank you.
You're welcome.
Actually, I want to pivot really quick. I'm going to stop sharing. I can reshare this. This information is also on the Whova app. So if anyone wants to contact you directly, I'll post it at the end. So because we have a smaller group today, I thought it would be nice just to have each do a quick introduction, and then kind of we can see if there's questions, and if there's not immediate questions right now, nonprofits, yes, thank you. Not immediate questions right now, maybe we can just do more of a discussion based.
Sure.
So, how does that sound?
I'd love to. And please don't be shy. Jump in, ask questions. If you have questions about employment, education, I'm here for you. I'm a clinical supervisor as well as a practitioner and a faculty member. So please utilize my talents to help you in your endeavors.
Awesome. Thank you. Jessie, you want to go first?
Sure. So my name is Jessie Hartley, and I actually just graduated from the online program in the School of Social Work. Prior to that, I was in the nonprofit world for years. I was a therapist. I was an executive director. I had left the field and I was actually working at Tulane, so in alumni relations, so I recognize a lot of the names and faces here, and then decided to go back part-time for the Masters of Social Work program when I saw that it was online and could, easily accessible. I finished my last few semesters full-time just because of internship opportunities, and ended up doing my internship at Orleans Parish Juvenile Court, which has really, kind of focused, I have now focused my attention on work related to trauma-informed practices in the city, the criminal legal system. I tend to kind of focus, wanted to focus more at a policy level. So I have had a little bit harder time. There are definitely a lot of clinical opportunities available. But currently I'm finding that contract work has been kind of my best opportunity. And I've been working on the Call to Care initiative to make New Orleans a more trauma-informed city with the Children and Youth Planning Board, which has been just fantastic opportunity. So yeah, that's me.
Thank you for your work, Jessie. If I could react, Sarah, before we move to the next person's narrative. Jessie, we do find in Louisiana in particular, students or graduates generally start in a more clinical placement and learn to maneuver those and navigate those systems in order to move into more programmatic and or policy work. For instance, a graduate from 2018 started out in drug court. She wanted to be in policy. And we worked on a plan of, okay, get into the system, learn the system that will inform the policies and programs and procedures that you want to implement. And here she is a year and a half later, and she saw what we were emphasizing, because that micro to macro piece, that clinical community piece is important, because you have to be able to maneuver across the spectrum. You're not micro or macro. You have to understand the needs at the person and environment level in order to inform programmatic change, which is informed by policy. Again, a year and a half later, that's one example of how the student has seen how being an advocate with clients in drug court has informed how she wants to use and influence policy for programmatic change, to make some recommendations for drug court as an example, as well as other programs. So thank you for your work. I definitely see an opportunity there's a trauma-informed program with Professor Whalen that I'd like to talk to you about offline, that is in many of our schools here in New Orleans, and it could be a model for schools across the nation with regard to how the social workers and teachers are trained and how that impacts the classroom to keep our students engaged, retained, and through graduation at the high school and elementary levels, and how that can influence the system in a more macro way. So let's make a point to talk again about that opportunity, which starts in the micro level, but takes you to the macro involvement. Thank you, Jessie.
Thank you. Yes, I would love that. And I have definitely shifted, and I am applying for some more clinical roles currently. So great advice. Yeah. Thank you.
Of course.
Joe, would you like to jump in?
Why not? So I'm still, I guess, trying to find my way. I've been looking for not so much a clinical position, but more of, I guess, an advocate position. And I think I've figured out now I kind of want to work with youth, with young people. The job I had with ARJ when I was working in mental health rehab, I really kind of enjoyed what I was doing there, and I've had problems trying to figure out where my place in social work is, because I'm kind of one of those people that has problems making decisions, and everything looks appealing, at all. I want to help these people. I want to work in this. I want to work in that. So it's been kind of difficult for me. But I got 2 interviews next week, and one of them I think is going back into mental health rehab, and the other one is with the municipal court, with traffic court. So I hope that turns out pretty well.
Joe, can you say more about the second one? Can you say more about that second job interview? Specifically, what might you be doing?
I don't really know. I don't know. I remember filling the application out. I went back to look at the job notice on the city job board, and it's not there no more. It's not there anymore. I looked at the application that I filled out, and it just kind of gives a general description of the duties. So it doesn't really give a description of the population I'd be working with or exactly what I would be doing. The only thing I can figure out for traffic court might be like DWI and maybe working with alcohol abuse.
Interesting. So if you would like, I'd be more than happy to talk with you after both interviews. Since you said you have trouble making decisions, I'd be happy to hear you think about what you've said that you are interested in, specifically adolescents, which would probably be in both of those populations based on the services. I'd be happy to just listen and help you explore which one might be more productive and rewarding, and lead you on a path towards that. You said that policy piece, that advocacy piece. So reach out if you're willing, and I'd be happy to talk with you. As an alum, your experience is important to me. Want to hear about how your field experience informed what you're doing now. And so there it is. Be happy to have a conversation with you.
Most definitely. Most definitely. Any help I can get is very much appreciated.
Sure.
I worked for a nonprofit called Silence is Violence for a while.
Yes, I know them.
Oh, you do?
Yes.
Oh, wow.
Yes.
Yeah.
I took a class over there in 2017. In 2018, they were too busy, but yes, we visited. Yes. Keep going. I think we met there. I brought over a yellow plant, and I think you met me at the door when I brought a mom over there to thank the director for spending time with us. Now that it's coming back to me, Joe. It's coming back to me.
I remember, yeah. Yeah.
So, yeah.
But incidentally, in the same building, there was another group that worked with a church.
Mm-hmm.
And one of the guys that was in there is starting his own church in the 9th Ward. And I've gotten kind of involved with him, trying to help him set up his church.
Mm-hmm.
But he's been doing a lot to help. He put together a team, and he's working with his team to try and find purpose for everyone. So I've been working with him a little bit, but he's not that much familiar with social work. So
Okay.
I would really appreciate your help in so I could narrow down that direction that I really want to go.
Let's plan some time, because there are some faith-based services that might be appropriate.
Awesome. Oh, what a good connection. I'm so glad. Thanks for coming, Joe.
Yeah.
Elizabeth, would you like to introduce yourself? You're here? Elizabeth, whenever you're able to, we'd love to hear from you. I'm gonna move on. Dory Lynn, so good to see you. Do you wanna just say hi real quick?
Hi, everyone. Can you hear me okay?
Yes. Yeah.
So I'm not necessarily switching to the field of social work, but but I have a goddaughter who is getting her master's now. Sadly, not at Temple. I mean, not at Tulane, but at Temple, also a teen. I think she's going to be awesome at it, and I just thought I would listen in and see if I might hear any insights and tips that I might be able to share with her. I know she's specifically interested in people who have experienced trauma, domestic violence, that population. So she's been a yoga teacher in the past, and she's a certified yoga for trauma. And I think that's really kind of how this grew to be her passion now.
Oh, that's great.
So thank you.
Sure. Yeah, I think there'd be some really good resources can be shared here as well.
Dory Lynn, specifically, we have used our meditation room, and students have taken ownership and led yoga classes over the years. Of course, we can't do them right now during the pandemic, but there is a natural affinity to social work with people with experience with yoga. I think there's a population there. In fact, when we teach self-care, my colleagues and I who go and do self-care demonstrations and workshops for CEs with social workers, we always integrate some yoga, some mindfulness, etc. So definitely a need, and not only for as an intervention, but also as a form of self-care. So please encourage your niece to continue to practice using it for herself and to integrate it into her practice. Often students are artistic. They might come with a master's in art. They might come with a master's in music. Integrate, utilize those talents and those past experiences to meet our clients where they are. And so that would be my words of wisdom to tell your niece to continue to make that part of her practice. There are certifications that we can get, not necessary, but to continue to get that continuing ed to integrate those strengths that we already have to help us have solid practice and solid social work that's evidence informed and evidence based.
Thank you. Thank you so much.
Christiana, do you wanna say hi and introduce yourself?
Yes, hello everybody. Thank you for joining us today. Maria, thank you so much for being here to facilitate this, and Sarah for putting it all together. I think I know pretty much everybody on the call, but if not, I'm Christiana Letterman, the Director of Alumni Relations and Individual Giving with the Tulane School of Social Work, which is a mouthful unto itself. And I'm here to help you all engage with each other and with the school again. So I know that I am so fortunate to have Maria as both a colleague and an alum. She does some incredible work with us. So pleasure to meet you all. You can reach me at any point here at the university, and thank you for joining us today.
Thank you. Wanted to see, Elizabeth, are you able to get some audio with us? If not, if you want to share in the chat, just kind of who you are. Okay, I think we're gonna just open any questions. Anything you all, I think also if there's not any burning questions, I have found that it can be really helpful to just share kind of resources that you all are seeing. And Jessie, I know you mentioned you've seen some clinical positions. You know, I don't know if that would be helpful for Joe, or in terms of kind of like a more of a resource sharing opportunity. What would be helpful?
Yeah, I mean, I can share kind of the sites that I have found that tend to have, and I think there are a lot of them. I have gotten from my career coach, Sarah. But I feel like for clinical positions, Indeed is really fantastic. And with all of these, setting up those job alerts, so that it's, I mean, I've set them up for social justice, racial justice, I mean, Joe, if you're looking for advocacy work, you can do like keyword. Idealist is, there might be fewer, but it's also really good. Yes, Glassdoor. Work NOLA actually has, I've found a couple of positions, and of course, these tend to overlap. I feel like I might be forgetting, but I think those are the ones that I just consistently come back to. Sarah, am I missing? Oh, Sarah, what's the one that you told me about?
Career Shift?
Yes.
Yeah, Joe, have I told you about Career Shift? Joylyn, this is helpful for you too, and if you're not familiar with it. So Career Shift is a resource that Tulane has a contract with. So if you just Google Career Shift, they're going to want to take your money, so don't do that. Go to alumni.tulane.edu, and under benefits, it's honestly a little hidden. Benefits, career services, and then it's there. So Career Shift is a great website where it pulls every publicly listed job posting into one site. So that's why they want to charge you. But we have a agreement with them that it's free if you go through our individual link. And they also pull every publicly listed contact information. So if you have a job posting and you're not sure who the hiring manager is or who the executive director, like who to put on the cover letter basically, then you can go into Career Shift, type in that company name, and they'll show you. Sometimes you can see the org chart, sometimes you can see kind of the high level executives and staff. It's just a really cool resource. So instead of going to Monster and LinkedIn, all of those different sites, you can go to Career Shift and set up keyword searches and different folders, and it's a great resource. Awesome. Elizabeth, hi. Oh no, we can't hear you. I know.
You want to type into the chat, Elizabeth, and we will read your question and try to answer it. We want to welcome you however we can.
We're glad you're here. Oh, Elizabeth, I'm so sorry. We just can't hear you. Let's keep going.
Sarah, you brought up something that I thought about. Social work is a very relational field. And to Joe's question earlier, sometimes it's about using the network and using the connections for employment, for resources. I will tell you, the dean will reach out to me and say, hey, I need a social worker, but it can't be a social worker who might know XYZ. And so we provide resources, we use our network, even within our network, to help take care of our communities. And so in that example I just gave, like that, a particular, maybe a faculty member needed a resource, but it needed to be a resource that the faculty member didn't know. So we really use our net. We really use our network. And so I think Dory has a niece who's going to be joining the field of social work from Temple. And I applauded your niece because it doesn't matter what school you're from, you're part of the social work network. We need everyone in every community doing the work that matters, doing the work that helps bring resources to our communities and helps our communities continue to sustain and thrive and utilize those resources because they are experts of their own situations. So Joe, using the network, like what Sarah said, where Jessie shared some resources with you, and then like I'm reaching out to you as a colleague, hey, let's practice after your interview and see what questions you need to ask. Like I'll give you tips that I learned about how to get your supervision on site, how to and this is for your niece too, Dory, how to negotiate having your supervision provided through your agency versus having comp time to go have your supervision done externally if it's an external supervisor. So all those little tips are part of what we do as social workers to help take care of one another, because in the end, we are trying to work ourselves out of a job, as weird as that sounds. We don't want clients to need us because we want clients to be the experts and be able to thrive and survive. So just wanted to emphasize the relational piece and why I'm just so thankful that each of you made time to be with us here today, because you could have been anywhere else, but you came to try to support one another. So thank you.
Thank you. Elizabeth, I want to try one more time. I think we might have success.
Is it working now?
Yay!
All right. I apologize.
Thank you for trying.
I haven't used this app before, and actually my background is healthcare administration, and then I did some substitute teaching and whatever. But I've been out of the paid workforce for a while, raising a family and doing a lot of volunteer work, and I'm in the process of looking to get back into paid employment And so I'm trying to figure out what I want to do and how to job hunt using all the current technology, because that was not a way I had to do it in the past. So that's where I am, and it's interesting to, I've volunteered with some nonprofits over the years, and interested to hear about development and where things are going with the social work as well. Mm-hmm. So thank you, and thank you for including me.
I'm so glad you're here. I want to make, I just put my email in the chat, but I can reach out to you directly. So I don't know if you heard in the beginning. So I am an alumni career counselor at Tulane. So, and I'm a graduate of the School of Social Work. So I actually don't tell anybody else, but I love working with social workers on career coaching. So if it's a free resource to all Tulane alums. So if that would be helpful to you, Elizabeth, to have a quick strategy session on just kind of like, just the lay of the land of what job searching is right now and some tips and tricks, happy to do so.
I appreciate that. Thank you so much.
Sure. Dr. Glad, do you want to talk a little bit more about kind of the nonprofit world? I know that wasn't something that you touched on earlier.
Sure. So social workers are integral to the nonprofits. We are at the heart of grassroots efforts, which generally can result in the development of a nonprofit. It's not uncommon to see a social worker as the CEO of a nonprofit because of our mission, our core values, and how that aligns with dignity and respect for all people, which includes creating access to education, to healthcare, to services. So it's not going to be uncommon for a social worker to be the CEO and or someone integral to a nonprofit. So Elizabeth, what you suggest is the opportunity to work with interdisciplinary teams where there might be lawyers, human resource professionals, social workers, medical professionals, and other stakeholders who are truly invested in providing services. If you have a specific question about an agency, I'd be happy to answer those. And it sounds like a strategy meeting with Sarah would be a great step as you're transitioning into this next part of your narrative. Do you have a question about an agency that I might be able to try to answer?
Not at this time.
Okay. Well, if you think of one, reach back out. If there's a particular nonprofit that you have a question about, I'm happy to supplement whatever Sarah shares with you. If I have a resource that you want you want to meet or would like an introduction, we can try to make that happen as well. We have lots of
great. Thank
you. So we have students in about 100 agencies here in the New Orleans area, and so that means that I know or have access to a social worker in those agencies. And we probably have about 300 agencies in the greater New Orleans area that we're working with or have worked with in some capacity. We're trying to renew some of those relationships. And so that may be a resource to help you.
Okay, thank you so much.
You're very welcome.
I did want to open it up in terms of, I know, Jessie, you talked about some like general job search boards, but I was just thinking, I know that there's like a Facebook group like NOLA Social Workers. Are there other resources that Dr. Claude or, that you all know that are just for social workers in terms of networking, job search? I guess, NASW, but I think more kind of local grassroots.
Mm-hmm. It's a good question. So the first thing that popped into my head is I work with all the directors of all of the BSW and MSW programs, but that would not be a network for everyone to have access to. I actually find the social work network, NASW Louisiana, NASW Texas, NASW Mississippi, so kind of broadening your net and not limiting yourself to only the Louisiana network, going to some conferences in a neighboring state and meeting those colleagues as well broadens our horizons. And to Dory's point, her niece is going to school in Texas, but Dory, your niece might end up here. So that's why you go to the other conferences. Like last year, I had a research assistant who presented her research at the Texas NASW conference and not the Louisiana conference, and it broadened her opportunities for employment. So I think to your point, Sarah, NASW and broadening it to the national. Like I actually go to the national NASW conference. And so I have colleagues in DC that I can make a phone call to because we made that network at that conference. Jessie, I don't know, I think we were all asked, and do you have any suggestions for us?
Social work
I've
specific,
used,
I don't. Other than what you mentioned.
I've used one. It's called, I think it was called Social Work Jobs,
Mm.
socialworkjobs.com or socialworkjobs.net.
Okay, awesome. Thank you.
I'm
Yeah,
I'm looking for the site.
I think on some level, I want to keep this in a positive spin, and also recognizing that I do think that there's so much of us. I agree with your point of like, our work is so relational. And I think sometimes for those of us that are on the job seeking side that haven't yet created those relationships, I would say this is almost one of those like catch-22s where it's a beautiful thing on the relationship side, but when you're not yet established with those relationships, it's hard to get started. So I think as much as we can do resource sharing and referral and, hey, I know this person, and, that just to almost like shepherd in those, the new social workers.
I agree.
Hard in the time of COVID too, because we can't do in-person networking.
I agree, Sarah. And to your point, that's part of the socialization that I'm intentional about when students are at agencies, encouraging them to be courageous, be confident, and introduce yourself to the colleague or future colleague across the table, growing in your identity of moving and shifting from this intern identity. Like I had a conversation with a student 2 weeks ago. All right, come on, last semester, let's shift from this I'm an intern to this is your colleague. So, sit up, shoulders up, engage and network with this person who's going to be your colleague in 3 months. To your point about this could be a future employer, this could be a future co-author on a grant, this could be an agency with which you write a grant to bring services to a shared community. So I agree that relational piece has to be operationalized, and I help the students operationalize it in that you are part of the relationship and you are learning to maneuver these systems and broaden your network, which was my point of immersing the student from here, even in that Texas environment, so that they could see that our network doesn't have to be limited to Louisiana. We have clients that move across states and move if their disability. A common question, is my disability going to be cut off if I move from Louisiana to Texas? No, it's not. You're going to have a different address to where your correspondence will be received, and your bank account will remain the same, but you'll change your address on your bank account. So that relational piece is huge, and we need to your point, operationalize it in a way that people understand that we must utilize the networking opportunities and socialize students and graduates and mentor students and graduates to see how to utilize opportunities to grow our networks, number one, for employment opportunities, and number two, towards services that are integrated and holistic in our approach to meet our clients' needs. At the end of the day, it's about the community.
Absolutely. Thank you. So we have about 4 minutes left. Any final thoughts or advice, feedback?
I'd like to say anyone here, if you have not already set up a strategy meeting with Sarah, you should, because I will tell you that's a opportunity that has grown out of, I guess, feedback and us justifying need. We hit the ground running when I graduated, and I think Hurricane Katrina helped with some of that because there was so much need. Here is another opportunity. Whereas we can't control this pandemic, we can take this opportunity to see what the needs of our communities are. Remember those needs assessments that you learned in school and or that your niece or your family member is learning? Utilize those needs assessment skills, determine where that aligns with the target population you're interested in working with, and the services to which you have passion and commitment, and the services to which you can commit to and manage with your balance of self-care, that mindfulness, the yoga, the art, whatever it is that gives life back to you. Balancing all of that. So Joe, deciding on which job to take, which aligns well with your long-term goals, which aligns well with your policy work and intentions, Jessie, and being committed to it in a way that makes you stay motivated as a social worker and committed to the cause of really helping our communities. So utilize Sarah as a resource, reach out to me if I can be of assistance, and take some ownership and responsibility, and don't be shy to reach across the table and talk to that social worker in that CE. Don't be shy to talk to the state representative who's on the corner saying, please, vote for me in the election coming up, or whoever the politicians are. Figure out what their messaging is, how they're contributing to the nonprofits, and how we can continue to move our communities forward. So being intentional about your time and your use of your energy and your talents. And thank you all again for choosing to be here when you could have been anywhere else.
Thank you so much for your time. I know this was very insightful for me. I learned a lot. I hope it was helpful for those of us that were able to join. And this is being recorded, so we will be posting this to share far and wide, which I'm excited about. Okay, with that, I'm going to say thank you again for coming, and have a good day. There are continue to be more sessions throughout the day, so if there are things that are of other interest to you, starting honestly at 1:30, please join in. It's all on the app. So thank you again, and have a good day, everyone.
Thank you. Bye-bye, everyone.